All right. Thank you so much, everyone, for being here. My name is Jollina Simpson, and I am a traditional midwife in IBCLC working in Las Vegas, Nevada. And my project was to create a toolkit for lactation support professionals supporting lactating people with physical disabilities. So this is just reiterating the Google Doc, and I want to make sure that everybody can also participate in ways that feel comfortable for them. So if you want to go off camera, please feel free to go off camera. If you need to stay on camera and give me snaps during the presentation, stay on camera and give snaps. If you want to put it in the doc, put it in the doc. However you want to participate in this presentation, you are welcome to do so. And I will keep going. Our agenda today, we're going to talk about the genesis of this project and ableism. We're going to be using inclusive language, focusing very much on our literature review on the Americans with Disabilities Act and lactation education and support. We'll talk about the specific aims of the toolkit, the methods, and we'll get to see a little bit of the toolkit itself, as well as go over the results and discussion. So the genesis of this project for me was a set of stairs. I was coming off of a pretty long birth, and as I approach my 50th year, long births take a lot more out of me. And so my hips were hurting, my knees were hurting, but I had to get to a midwife's friend's office and deliver something that I had of hers. And I got to the set of stairs, and man, they looked tall, they looked hard. And I was trying to find the elevator, and I couldn't find the elevator, so I had to climb the stairs. And then I had to find her office, which was way at the other end of the building. And I was like, daggone, what if I was in a wheelchair? What if I was walking with a cane? And then I said, well, wait a minute. Have I done that in my practice? What have I done? What barriers have I created for lactating people or birthing people in the places where I dwell, in the places where I control? And the answer is yes. Yes, I have done it. We've all done it because our society is built for non-disabled people. So I set out to identify the barriers that I have created in my own practices and in my own professional life, and I set out to do better. And so when I started working on this project, it felt like a natural synthesis to start building something for other professionals like myself to be able to change now, to do better now. All right, so just a little bit about ableism and ableist views. So ableism is discrimination in prioritizing non-disabled bodies in your language, in your space, and in your practice. Ableist language upholds discrimination by centering non-disabled people's life, their experiences, and their preferences. Ableism can take many forms, such as using derogatory slang for people with mobile disabilities, or being out of compliance with the American with Disabilities Act, or something that I see quite often is saying that a person with a physical disability who is parenting or lactating is an inspiration or a hero just for living their life. Ableism is not just the act of individuals. However, individuals need to recognize their role in the systemic oppression and take steps to rectify their own ableist mindset, their own practices, and their policies. Now, when it comes right down to it, in healthcare, ableist clinical practices are harmful, and they impact a person's access to appropriate care, respect, and autonomy. Clinical ableism comes with serious, violent, and sometimes deadly consequences for people with disabilities and their children. So addressing ableism is important on all levels, but my focus is on the lactation support professional. I want to take a second to talk about inclusive language. In this presentation, I will be modeling the inclusive language that is used in the toolkit. There will be times that I will use the word woman or female or mother, but those are in quotes because I do not want to erase someone's self-identified identity. I will also be using lactating people, and I will also be using people first language in disability. So that means a lactating person with a disability instead of a disabled lactating person. Different disability communities address this in different ways, but generally in the physical disability realm, it is person first language. I'm going to give you a moment to just take a second and read this. This is a quote from the WHO and their call to help to dismantle systems of oppression. And it reads, "The right to health must be enjoyed without discrimination on the grounds of race, age, ethnicity, or any other status. Non-discrimination and equality requires states to take steps to redress any discrimination, practice, or policy." And I bring that down to the practice level. It requires lactation support professionals to address and take steps to dismantle their own barriers to access for physically disabled lactating people. So first, I started off with the literature review, which required me to do a deep dive into the Americans with Disabilities Act and lactation education. So we're going to get into that, but the literature review is vast, but I want to concentrate a little bit on the American with Disabilities Act first. So on July 26, 1990, the Americans with Disabilities Act, also called the ADA, was signed into law in the United States. The ADA guaranteed protections for people with disabilities in the U.S. The bill was introduced to the U.S. Senate in 1988, and it challenged the barriers that prevent equal treatment under the law for people with disabilities. When the final provisions of the ADA went into effect in 1992, it was broken into 5 sections: Title I, Employment; Title II, Public Services; Title III, Public Accommodations; Title IV, Telecommunications; and Title V is Miscellaneous. The ADA protections have been expanded in the past 30 years to include many emerging technologies. So the part that affects lactation support professionals is Title II, which prohibits discrimination on the basis of disability and applies to all services, programs, and activities provided and made available for public entities. So the ADA was one part of my literature review, but the rest of the literature review included a search on several peer-reviewed sites, and I wasn't really finding a whole heck of a lot. I think all in total, when it came down to the intersection of lactation and physical disability, I found about 8 papers, and most of those papers were published in the last 5 years, and some of them 2020 or 2020, 2021, and even this year I even was able to kind of rope that one into. So it is not, there's not a lot being talked about in the in academia and scholarship around specifically around that. The search parameters I used were breastfeeding, chest feeding, lactation, breastfeeding support, lactation education, of course, physical disabilities, people with physical disabilities, and so on. There were many kinds of subcategories and many combinations that I used in order to do these searches, but a lot of it just came back to pulling in information from multiple publications that didn't necessarily center on lactation, but centered more broadly on medical access and disability. In addition to the peer-reviewed articles, it was necessary to utilize websites, conference slides, blog posts, gray literature, and lots and lots of social media in order to access the words and narratives of people with disabilities. The literature review showed us that globally, people with physical disabilities make up 15% of the population, and 80% of disabled people are in low and middle income countries with limited access to lactation support, but with rich histories of familiar lactation support. So that's really important. Most of the studies were done in rich majority white countries and very little focused on low income Black and brown people who are disproportionately affected by disability. In the United States, 36 million women have disabilities, and that number is growing, especially with COVID and the mass disabling effect that it's having. Of that 36 million, 6.5% are of childbearing age. Physically disabled people have a higher level of comorbidities that impact their health and their infants' health. There are, worldwide, there are 33,492 IBCLCs. Over half of those are in the United States. So we have by far the best support for lactating people across the globe. There are also 5,256 La Leche League leaders, half of which are in North America. Now, La Leche League is a peer-to-peer volunteer organization that has been around for a very long time, supporting lactating people on their journey. So where the literature was kind of failing me, this academic literature, the disability community was all in. They're talking about it. They are talking about lactation support. They are talking about access. They are talking about what they need in order to live their whole lives in a way that is well supported. One specific publication called Disability, Postpartum, and Parenting International was being published in the 1990s. They no longer publish actual magazines, but they are online, and they have a great and rich resource for anyone looking for the narratives of disabled people. And of course, I went on Facebook, and I went to Instagram, and I went to TikTok. One of my favorite TikTokers is Crutches and Spice, and she talks a lot about disability and access. And it was a broad, wide range of trying to incorporate the stories and the narrative of the disability community. All right, I want to, oh, doesn't seem to be moving. Nope, sorry y'all, hold on.
We do see the next slide now.
Okay. So I want to take a second to talk about what lactation support professionals are. So lactation support professionals is a broad scope term for anyone who is assisting lactating people on their lactation journey. So that includes volunteers, paraprofessionals, which can be doulas, certified lactation educators, certified lactation counselors. It's a wide range. And it also includes medical and allied health professionals and international board certified lactation consultants, IBCLCs. So lactation support professional, even though it says professional, I don't want you to think that it discludes volunteers, because volunteers actually impact a lot of folks' journeys in lactation. Okay, so again, coming back to the literature and thinking about what this means, the lactation professionals and their impact on physically disabled parents, right? So lactation initiation in the United States is 84.1%. Now that's great, right? That's great. That's 2019. So it is important to understand that there is no specific data on the numbers of physically disabled lactating people there's no specific data. Like, I could not find it. And so that was important. Like, we are not even tracking this to know what we can do better. The second really interesting piece of information was that at 3 months, non-disabled people are still chest and breastfeeding at 33.4%, but disabled parents are at 24.4%. So that's a big disparity, and it's something that can be addressed. The other really important part of this conversation are the infants born to people with disabilities. So the infants born to lactating parents with physical disabilities are 3.4% more likely to be born early. And that is a huge cost, and it's a huge burden. Okay. When it comes down to understanding what lactation professionals need to know, first I needed to talk about how to define how disability was defined, specifically physical disability. And we talk about structural impairments and we talk about functional impairments, but there are also invisible impairments that many lactation professionals don't even know about. And so when they're going to support families, they discount that disability because they can't see it. So in the toolkit, it's important to define what all these different disabilities are. The specific aims of my project was to create a framework of advocacy based on the Americans with Disabilities Act for lactation support professionals. Give them terminology, so appropriate terminology for diverse disability communities, to provide them with a way to build local and regional resources so that they can better build their practice so that they can support parents with disabilities. And finally, giving them accessible tools and strategies to suggest when they're in the field. The methods that I used, in addition to the literature review, was gathering narratives both online and in the peer review data, and separating those out based on the needs of the lactating people who told their stories. And those broke out into 4 basic areas, which is representation, support, terminology, and access. And then taking those and splitting them apart for the toolkit, I had to build a toolkit on Canva, which is my favorite site right now. And then I also built a website to display and to disseminate the toolkit on Wix.com. Throughout each step of the way, I was looking at accessibility. So when I was done with the toolkit and done with the website, I put the website through waveaim.org, which is a free online access website evaluation tool. And then I had to go back through and fix all of the things that it told me to fix. And there was lots of them, and I am not a website builder, so there were a few things that I was not able to fix. For the toolkit itself, I put it through Outlook's accessibility tool and then fixed all of those points as well before letting the website go live. And then I went out and I hit up all my friends, my family, my colleagues. I went on Facebook and I posted it in all of my lactation Facebook groups. And I went to Breastfeeding Coalition meetings. I'm like, hey, I need everybody to look at this, because I was looking for professionals, midwives, lactation consultants, everybody to take a look at this so that they would be able to be reviewers for it and tell me if I was on the right track, if I was giving knowledge that was applicable and appropriate. All right. Before we go any further, I'm just going to put one quote up. And at every step of the way, centering the voices of lactating disabled people was my goal. And throughout this presentation, I have layered them in there because it is so important for me to continuously center the voices of those people who we are charged to serve. And so when I think about the barriers, I want to always come back to what can I, as a professional, do better. Okay. So on to the toolkit. Excuse me. So this is the website, and it was built on Wix.com. And it just has a landing page, and then as you scroll down, you can click on the different resources. So I have the full toolkit on the website, as well as each individual chapter broken out, so that if you are looking for terminology, you can go straight to terminology. If you're looking for advocacy, you can go straight to advocacy, so you don't have to read the whole thing to go through it all. Okay. Here she goes. Can you guys see my next slide? No. Yeah. Let's see. Okay, here we are. When I started out the toolkit, I wanted to make sure that I was introducing the ADA and making sure, oh, sorry, it's not playing. It's a little video, but if you have access to the link, you can go ahead and take a look at that. I wanted to introduce lactation support professionals to the ADA and give them appropriate terminology for persons with disability and terms to use and terms not to use. And this is very important because lactation support professionals span generations, and terms that were used widely 50, 10, even 25 years ago are not acceptable words to use, and we don't want to create additional harm. The next section is a framework for advocacy. Now, this is really one of the most important aspects of the toolkit, because it's not saying, you lactation consultant, go out and change the world. This is really about you changing you. You change your systems. You evaluate where your practice has barriers to access. You need to look at what is around you and then make a list and then have it evaluated by someone from the disability community. And then go back and update your list and update your protocols. But it always keeps coming back to the disability community. We should not be doing anything for the disability community without their input and say so. The next part of the toolkit is building resources. And again, this is for the lactation support professional to build their capacity to serve. So it outlines federal, state, regional, and local organizations to improve their practice, so improve their ability to serve their clients. And finally, the largest part of the toolkit is the clinical practice portion of the toolkit. It includes pre-appointment instructions, in-appointment considerations, practice accessibility, and clinical terminology. And this clinical terminology goes into detail on the different types of disability and the different comorbidities that might also be involved in affecting lactation. And it gets really specific in that. So again, I want to go back to a quote, and I know that I'm running low on time, but I'll get through it, I promise. This one spoke to me because it really is about access and just not believing that a lactating person with a disability would even need this information. And so once you find a provider, once this person found a provider who cared for them, cared about their voice, and made all the difference in the world. And that is what is important to me as a lactation consultant building this tool. I want to make sure that people are prepared to be able to serve. All right. So there were great results. I had approximately 15 people give feedback on the tool, and overall it was really favorable. And then I broke it down into navigating the tool, the content of the tool, impact on practice, and the demographics of the reviewers. I did not ask for demographics, but most people sent me their reviews via email or Facebook, and they included who they were in it. So I just kind of got that as a bonus. All right. So again, we always come back to the needs of the parent, right? and we come back to the needs of what we all want post-birth. And this is no different for lactating people with physical disabilities. They want their needs to be met, their fears and questions to be taken seriously and without judgment. And that is what I hope this toolkit will provide for lactation support professionals who are in the field. Okay, so the strengths of the toolkit that I have so far is that it fills a gap that currently exists in lactation education. There is nothing like this in our field. There are very few words about disability in most of the common lactation textbooks and trainings. This tool was created with accessibility at its center. So I was always making sure and looking to see, is this text too small? Is the background too bright, which created other types of accessibility issues? So I was always keeping accessibility at its center. And the Lactation Support Professional tool uses the lens and scholarship and activism of the disability community to build the foundations and understanding for the kit, not the scholarship of lactation, because we get our field, we get that. We need to make sure that we're building scholarship from the disabilities community. And the toolkit also uses explicit and implicit representation of varied identities. So you'll see someone on crutches who looks male identifying carrying around a baby. You'll see someone who is chest feeding who may only have, who only has one upper limb. And you'll see different nationalities represented as well. Because I couldn't find any pictures of those, so I had to kind of pull and create on some of those. So I also wanted to represent in the toolkit the rich and diverse lives of people with disabilities, because all too often in the media, people with disabilities, first, they're not pregnant, they're not nursing, they're not doing any of those things. They're in a wheelchair being pushed by someone. And people with disabilities have rich and diverse lives, and I wanted to make sure to represent that as well. I wanted to represent parents with a wide range of visible and non-visible physical disabilities. And you will also, in the toolkit, there is a double amputee who is feeding with a bottle. So that is also represented because pumping is a big part of supporting lactating people with physical disabilities. Another strength of the project is that the overall reception of the toolkit was very positive, so that's good. The limitations were, number one, it was conceived and created by a non-physically disabled person, which is me. So I didn't have access to community and deep understanding, and that did show in some of my results. There was limited access to lactation-specific education materials, which means there are tons of trainings out there, and I could not get access to all of them in order to evaluate their books. I called friends, I had people give me stuff, but I just don't have that kind of broad-level access. And of course, the absence of a website designer and support, that was problematic. And the fact that this was created for English-speaking lactation support professionals with access to the internet. And what I said before is that 80% of disabled people do not live in places like this. So that is a definite limitation. And finally, not having access to a large number of lactating people with physical disabilities to review the kit is an absolute limitation. So the next steps, oops, oh gosh, sorry. The next steps would be first to have the tool evaluated by disability rights advocates and lactating people with disabilities. And second, have a professional evaluation of the tool itself and the website for accessibility issues. And finally, to publish the site and keep a forum open for additional input and stories around disability and support the disability community in making changes within the curriculum in order to support them. And this is the last slide, and it's just saying until accessibility becomes a standard part of lactation education, providing lactation support professionals with appropriate terminology and tools to evaluate their own clinical practice reduces harm. The Lactation Support Professional Toolkit shifts the framework framework of long-held myths and stereotypes around disability and identifies systemic barriers to care in the lactation professionals' policies, practices, and education. So finally, I got big shout outs. I got big shout outs first to my family and my ancestors because they've been here with me, watching me cry, holding me up, holding me down. And so that's really all I can ask for. To my committee, my chair, and my 2 other committee members, and I have been through 2 cohorts because I had to tap out at the middle of this program and had to come back a year later. So I've been through 2 cohorts, and I really appreciate all of their support, and really, they've been really kind and amazing. And of course, to all the reviewers, I was out there hustling this thing, and I really needed people to look at it so that I could make changes. So I'm eternally grateful for them and for allowing me to step into this space. And finally, here's a small smidgen of some of the references that I used. Thank you.
Wow, thank you so much, Jollina. Really so awesome that you could create this tool that obviously is very needed. To only be able to find 8, peer-reviewed journal articles. You clearly identified a gap, and starting to fill that gap. So thank you for stepping into that space. Is there anyone today who has any questions for Jollina? You can unmute yourself. You can raise your hand.
Andrea, do you have a question?
I do. Hi, Jollina.
Oh, good.
This was really wonderful. And I said to Christine, I've been waiting 2 years to see this presentation. So I'm so excited to finally see it. My question for you is can you talk about a couple of changes that came about in your practice? But you're muted.
Yeah. One of the biggest things that came up when I was going through and looking at the literature was I actually expanded a lot more on terminology and physical disabilities and congenital disabilities that impact lactation. I hadn't expected to need to do that, but when I got into the lactation education space, I wasn't getting it all in one space, and it was really, I was kind of dipping and diving into all these places, and it wasn't in one place. So I felt like I needed to do more research on those specific physical disabilities and congenital disabilities as well. So that's one thing that I changed in my own practice, is evaluating congenital disabilities along with physical disabilities and looking at comorbidities. Did I get it all, Andrea? Did I get you? Okay, cool.
I see a hand raised from Natasha Peterson.
Thank you. Great job, Jollina.
Thank you.
I just was wondering, it was a slide way back at the beginning where you mentioned, I don't remember the exact percentage of, for the rate of preterm babies or preterm laborers for people with disabilities.
Mm-hmm.
Was that a particular, were you able to figure out what was the reasoning for that, or was that just like a broad, I've never researched that to even, know anything, but as a midwifery student, we don't usually get a lot of people that have disabilities of what, at least physical ones that we can see. But I just wondered if it was something medical, or is it more, I don't know, is it once again, not being heard and something's being missed, or what those things?
Yeah, it's a little bit of both of those things. So some of it is actually the comorbidities intertwined with having a physical disability. And so there might be reasons that a parent will have to deliver early because it's a risk to their health. But it's also the other side of it, of not, that medical providers just don't know what to do with it. because they don't know, they haven't had the education, and they don't know how to assess medications. They don't know how to assess risk across different disability groups. And so they kind of get a full-on blanket assessment, and that's not helpful to specifically people with physical disabilities. And so when it comes down to that 3.4% higher preterm rate, that really is a combination of not being well educated, not having the correct support, and not really having people who know how to deal with a specific disability. Thank you for that question.
And it looks like they're in the chat as well. I'm not sure if you'd like to unmute yourself, feel free. Yeah. Any other questions anyone has? Well, if we don't have any more questions today, I just want to say congratulations, amazing work. You are incredibly deserving of your soon coming Masters of Arts in Maternal Child Health Systems. And we did get to see your family at the end. So
yes,
we're all happy here.
I think my daughter and my sister, one of my daughters and my sisters are here. So that's really wonderful.
Good. Okay, yes. Well, and we would love to, yeah, thank you for supporting Jollina and for being here all through. Yeah.